Welcome to the Menopause and Cancer podcast, where we speak with cancer patients, survivors, and incredible experts in their fields to help us find solutions to our symptoms and ideas to improve our health. My name is Danny Binnington, and I'm very excited to talk about whether turmeric, ashwagandha, red clover, and soy in whole food supplements are safe products for you to use, or whether there are contraindications for some of you. Because so much of the narrative out there is herbal medication or supplements might be contraindicated, and then people stay away from them. That to me is not good enough, because there are great benefits to using supplements and herbal medication like this. And we all deserve the data, the science, and the facts behind those products. And so I've got two brilliant women here with me today who are helping us find the answers to those difficult questions. I'm joined by Dr. Vera Martins. She's a naturopath and herbalist with a PhD in cancer biology. She'll answer all of the technical questions for us. And I'm also joined by Rebekah Brown. Rebekah runs a brilliant community and a product-based business, MPowder. And I can't tell you how grateful I am that these ladies are actually holding their hands up and saying, this is what we know. This is what we don't know. Let's use science to make an informed decision. I'm going to welcome these ladies in. I can't wait for this conversation. Stay to the end. I've got something very important to announce. I have been waiting with anticipation to quiz you two clever ladies. Vera, let's go straight to you. Tell me, we're talking about herbal supplements today. Are all herbal supplements safe? Because at the end of the day, they're just herbal supplements. So can all of us just happily take herbal food supplements?
Hi, Danny and Rebekah. It's a pleasure being here today with you, Danny, and connecting with you and your community. And I find that the work that you are doing extremely important. And to answer your question, the short answer is no.
So this is great, isn't it? Because I just went into our Instagram community yesterday and I said to people, how many of you are worried about the safety of herbal supplements? And 100% said that they were worried. And so rightly so, right? They need to be worried because they're not all safe. But how do I find trusted information, Vera? Because it's a minefield out there.
Yeah, I think we need to start thinking about, what's the reason for that? And I think it's because there are not enough studies. So not enough studies of good quality. And I think the main issues are around, the number of participants in studies being often low, having situations where the studies are done mainly, for some herbs, we may have data available only in animal models or in vitro, meaning, in the lab. So there's a lack of proper, human studies, clinical trials. And then, that doesn't allow for consistency and significant data that we can actually rely. And so this leads to quite a lot of confusion, and that we actually know that because even when we speak to a doctor, you don't really get the clarity that you may want. And that's just because, simply the data may not be there. And so doctors often choose to actually have a more conservative approach. But this doesn't help you in a way, does it? Like you still don't know what to do. So I think, what we're trying to do here today, and what I think what would like to empower women here today to know and to learn is that there is data. So first of all, there is data, and that data is what can guide us. And we are going to, the most important thing I would say is we're going to share with you, trustable, reliable sources, because that's how you can do your research, your own research. So we're going to share that. There is quite a lot available. And then, what can you do? What kind of questions and considerations you may want to keep in mind when you go and do your own research? And I would say start by looking at possible interactions. I think that must be the one of the most important. I think also going back to your questions, are all herbal supplements safe? No, and I think they're mainly some of the issues may actually be linked to possible interactions, especially if there is a patient that is undergoing cancer treatment. So do your research really well in that sense. Yeah.
Yeah, and you are our starting point for our research today.
And then the next one is to look at the quality of the supplements. I guess this applies to anyone, but in this context, even more, because, patients may be already suffering from side effects. You don't want to have supplements that are of poor quality that can impact on that due to the fact they have, unnecessary additives that can cause possible allergies, gut issues. So, nausea, for instance, these are things you definitely want to avoid, and you want that supplement to work. So you want good quality supplements that are bioavailable. That means that your body can absorb them properly and with minimal side effects. So do that research as well. There you may actually benefit from talking to a health practitioner that can guide you. But there is information out there as well. And the final consideration I want to make is, particularly if you have a hormone-sensitive type of cancer, you may want to consider if a particular supplement has phytoestrogens. And we're going to talk a little bit more about them today. But phytoestrogens are substances that naturally occur in plants, and they have the same structure of our, of the estrogen that our bodies naturally produce. So they are extremely helpful in terms of managing menopausal symptoms, but at the same time, there are concerns that they may actually, impact obviously on cancer, because they mimic, the molecule, the estrogen molecule.
Hey, thanks for watching this episode. 73% of people who watch my podcast haven't yet clicked the subscribe button, and 11% haven't hit the button to turn on notifications. I want these conversations to reach as many women as possible who might need to hear them. So if you've ever enjoyed listening to this podcast, please hit subscribe now. Rebekah, you and I, when we spoke in the past, we both share the same frustration, and that is the worry of the safety around products like this stops women in my community then accessing supplements or medication or foods, in some cases even, that could actually be really helpful for them. And so by just saying to people, just be careful, there might be contraindications, I think we're all doing such a big disjustice to everyone in that community. And so I'm very grateful that, as a community, but also as a brand with a product, that you've actually taken the time to come on here and explain to us, and also say, hang on a minute, our product is not right for everyone. And I'm really grateful that you're there to also show and share with us what we don't know, because there are many people telling you all the things we know, but not a lot of people say, actually, we don't know everything.
And I think that is such a good point. And, as Vera echoed at the beginning of this chat, it's such a joy to be collaborating with the community you have as well. And I think that word community is the most important part of both of our endeavours as individuals and founders, is that MPowder is a community first and foremost. And we formulate these botanical blends through the lens of naturopathy, which we're very passionate about, but we are there first and foremost to be a supportive educational community where people can kind of hopefully come navigate our product range if that feels right for them, talk to our health concierge team if that's what they need, talk to Vera if that's what they need, attend workshops with us, because it's that absence of knowledge, as you say, Danny, but it's also then that absence of curiosity where you're kind of just shut down, and so you're told that stuff won't be right for you, but that then you're left without any route forward. And so hopefully by having these conversations and ensuring that every voice is heard, and we understand what we do know and what we don't know, and also that science doesn't stand still, because I think that's the other frustration, is that quite often new sort of, you take ashwagandha as a perfect example, sort of superhero products come to market and there's a lot of buzz around them, and every magazine you open is talking about them, and they're being used in all kinds of different ways. And quite often, because of the caution that medical practitioners quite rightly have to apply to everything, they won't necessarily be able to keep pace or advise in a way that they're comfortable with. And so you're kind of left in this grey area where you have to do the homework. And if we can do the homework together, that's always a far better route as far as I'm concerned.
Yeah, because a real frustration for some women in my community is that the menopause conversation in the last few years, particularly in the UK, is very much HRT heavy and focused. And for many of the women who are told HRT is contraindicated, that's a bit annoying. It's like we are really happy for everyone that can go on HRT, obviously, but it's really difficult when it's so highlighted in the press and in the media and it's something we can't access. But the same with herbal medication. Because we have so many women and our friends who love MPowder and they love your blends and they actually say it's really helped them. But then we're sitting there thinking, oh, well, I'm not sure it's got turmeric in it or ashwagandha. I heard it might not be safe for me. And so again, we're feeling a little bit shut down. And I am someone that likes to do a bit of research, but I don't go into research in too much detail because I haven't got the brains necessarily for that. So I can't consistently think, who's going to help me find the answers? And so, Vera, I want to go straight to you and talk to you about turmeric, if you can, because I'm sat here with a turmeric latte today, if you can see. I put the yellow top on.
It looks like a good color, so it's probably good quality. Very, very vibrant.
It is. It is. And we know that turmeric is really beneficial. I want you to tell us what's important about turmeric, because I know you've included this in some of your products, but I also want to tell you, for part of our audience, turmeric might be a problem, or who should not have turmeric in this whole food supplement. Talk us through all of the turmeric dilemma.
Yes, so turmeric as one of, let's say, Rebekah was introducing, sort of same level as ashwagandha, is one of these, we call it like superhero herbs. It does touch on a lot of different, important areas of health. So turmeric, talking in more specifically, its active ingredient, curcumin. In fact, quite a lot of supplements rely just on the extract, the curcumin. So, standardized for that particular ingredient in turmeric. So turmeric, why is it so popular? And I think, in particularly, as you were saying, in the cancer community, for women that have less options, where HRT may not be a possibility, turmeric can be very helpful, because turmeric, it does help, for instance, with mood. That's one of his health benefits that may not be as commonly known. For instance, like, it's known as an anti-inflammatory, so it can help maybe with joint pains. It may help as well with metabolism, with immunity. But actually, its mood boosting effects are also quite well researched. So it's a really helpful herb, and it's quite well researched. So I think that's another reason why the supplement industry may rely so much on it. I want to start maybe by just giving you what I think is the bottom line. So what should you remember about turmeric if you are worried about it? Is that turmeric, I think the possible contraindications that there are out there now are mainly related if someone is taking, medication for cancer, particularly chemotherapy and tamoxifen. And this is actually also just in the case of a supplement. So I like to, we may explore this a little bit more here today, but there is a difference when we're talking about foods and supplements. So actually turmeric in its spice form is in all food form. There are no known contraindications, and experts recommend to eat it, to add it to your dishes normally, in moderate and reasonable amounts. So that's an important distinction I want to make. Food, like you were having it, Danny, like as a tea, perfect. But then when it comes to supplements, because then we're thinking about actually a quite concentrated, amount of turmeric, then is where the research is not clear. But one thing that there is some, like a red flag is, yes, if you are on medication, then may be contraindicated. And why is that? So there are studies showing, some possible contraindications there. So one study has shown that it can impact on, how your body metabolizes tamoxifen. So based on this study, and this is a clinical trial, based on this study, there is obviously like a warning there. But actually, I would like to highlight that this study in particular has used really high levels of turmeric in curcumin. So in this particular study, which, you don't see that those high amounts normally in the supplements, in the shelves. So that kind of already going back to what we were saying, I mean, the studies are conducted, but are they actually translating sometimes what happens in real life? Not necessarily. This is one alert there. And then the other, there's quite a few other studies in terms of how it can, impact on chemotherapy. Some actually show a positive result, others show a negative result. So that is contradictory. And they are actually the chemotherapy ones are more around preclinical studies. So, this is the data. But nevertheless, based on those studies, this data, the recommendations is if you are on cancer medication, be careful, talk to your doctor first.
This is fascinating, Vera. What you have explained is almost a similar scenario to what we have with using hormone replacement therapy after breast cancer. So the data is really old. We have contradictory data. There are studies that didn't show an increased risk of cancer recurrence, and there are studies that did show an increased risk of cancer recurrence. And the types of hormone replacement therapy that was used is not at all what would be used now. A little bit like turmeric. Yeah. It's unbelievable, really, to think that everything that we base our decisions on is kind of like a bit irrelevant because it's not the sort of product we would use. We wouldn't chuck all of this turmeric in your supplements, is what I'm hearing from you. And some studies have shown a benefit and some have shown a negative impact. Okay, so going back to what I'm drinking here, I've got about a teaspoon of turmeric in here. I was in India recently. I had the most amazing trip. I need to do a podcast on this. And all I bought was turmeric. And so this is proper Indian turmeric. I added a little bit of black pepper. I've got it in my coconut milk, which is what I like. And I've added a little bit of honey. So are you saying that in your, for example, MPowder blend, let's just take your formulations as an example, there is much more turmeric in than what I put in here?
Yes, quite possibly. Yes, it is more concentrated. In fact, we will talk a little bit more about our blends later on, but we are very transparent about our products. And so for our mood food, capsules which contain turmeric, we have that as a red flag. If you are on medication, then on cancer medication, then talk to your doctor first because of the presence of turmeric as an extract. So we have to go by the data. We have to go by what the experts recommend. And so the way it is provided there is not as all food. It is a turmeric extract. And so with higher concentrations of
But I love that. But I love that, Vera, because we've just sort of given everyone at home listening, thinking, I'm still on tamoxifen. People are on these drugs for 5 or 10 years. They might really want to look at a supplement. And we've just sort of done the legwork for them and said, actually, no, this is no good for you. But why don't you make yourself a turmeric tea or cook your curries? And there is no problem with that. And equally, you've also sort of answered that all these women out there after surgically onset menopause, for example, who are not on tamoxifen, who have debilitating joint ache, turmeric is a really good supplement. Because when you mention joint ache, I know 8 out of 10 people at home listening are going to think, oh my gosh, that's me. Joint ache is such a huge problem. And my left hip is so creaky and so achy that I often just have to revert to taking a paracetamol because I just want to switch off that grinding in my hip. Yeah, it's that low level sort of really grinding away. And I didn't actually know turmeric was so good for that joint ache. So that's really interesting for me. Let's talk about ashwagandha, because ashwagandha has recently been on my Instagram feed, left, right, and center. And the first time I came out it was with a herbal medicalist, Melinda McDougall, who helped me personally a few years back with my lymphedema, and she's such a fan of ashwagandha. Do you use it? Is it part of your blends? What are our, what's the benefit, and what are also, do we have concerns? I have no idea if there are concerns, actually. I didn't get as far as turmeric.
Yes, Dani, I'm so happy you are talking about ashwagandha because it's one of my favorite herbs. I think, Rebekah knows that very well. And, we have it in two blends, in two of our blends. So one of our foundational powders, so the Meno Boost, and then we have it also in our mood food. I just love ashwagandha. Yeah. And ashwagandha, it's. I think that you're going to hear to like probably what you're going to hear about ashwagandha, because the bottom line is there are no really known contraindications so far. So that's good. We're going to look a little bit more in detail, but that's the bottom line. And so why is ashwagandha so popular? And I think ashwagandha particularly, I use it so often, with my menopausal women, because it just does help in so many areas that are, a challenge during menopause. You name it. I mean, as a start point, it's an adaptogen, which is an herb that helps the body to adapt. What that means, we can get into more details, maybe, another time. It's a herb that helps the body to adapt by balancing the hypothalamus and the pituitary axis. And so it's basically one of the best adaptogens that I have, usually in my tool kit to support the stress response. So it's really, really amazing for that. It's been shown in several clinical trials. It's quite well researched, shown to reduce levels of cortisol. And so symptoms that it can help with, is, obviously reducing anxiety, also supporting sleep, mood, and increases your energy levels. So it's helpful as well in terms of fatigue. And this is so relevant in the context of menopause, but particularly I think for women that don't have as many options, in terms of HRT, this herb really ticks so many boxes. So I think it's important for women that are considered to take ashwagandha to do, their research, look if there are any possible contraindications in their specific case, because everyone is different. So, for instance, ashwagandha, there are no non-contraindications specific in terms of in the context of cancer or cancer medication, but we do know that ashwagandha is contraindicated if you have an hyperactive thyroid. So something to keep in mind. And also if you are on an immunosuppressant drug, as something to be careful about as well. But, in terms of, going back to the cancer context, if anything, there is some research, more recent research, showing that ashwagandha can actually be helpful in women going through chemotherapy, because it helps with quality of life and reducing symptoms of fatigue. So, I think it's a really powerful herb that women can consider in this community. Yeah.
And when you talk about stress, I have not spoken to anyone in our community who didn't say their stress levels were through the roof. And of course, anxiety is one of the most common symptoms of perimenopause for a woman who goes into menopause naturally, but compounded by a cancer diagnosis, by all the prodding, the treatments, the procedures, the worry about what's going to happen next. Stress is huge. And we know from talking to Dr. Anis Mukherjee and some incredible endocrinologists that all of our symptoms become worse if we're in heightened stress levels. And if that stress is chronically heightened, it can affect our bones, it can affect our metabolic health, it can affect so many other things, joint ache, so many things. And it's mad to think, isn't it? We've got this whole cycle of symptoms. Where do we start? And I wonder if we could all start with trying to reduce our stress levels, whether that would be a really good starting point. Because sometimes I speak to women and I've got no idea where this person could start first. With so many different symptoms, where do we go? Do we go to the doctor first, or the oncologist, or do we need to change our diet or lift weights, or where do you start? But stress is this common symptom that so many of us share. And perhaps we can do a little meditation and use some ashwagandha and tap into loads of tools and techniques to really lower our stress levels. Rebekah, I know that you had a really rubbish perimenopause journey yourself, isn't it? Which is why you've actually created then the community and tried to come up with a solution in the form of your whole food blends. Was stress a big part and anxiety a big part of your symptoms as well?
Yeah, it was, and it's really interesting to hear you sort of frame how we approach menopause symptoms in that way, because I think Vera will agree with me. We, through all of the experts, we also get the privilege of listening to as part of our community. How you digest stress is probably the most fundamental thing that we can do for ourselves as we transition through perimenopause into menopause. And quite often, I remember my early stages of my own investigation into getting back to good health, but also just talking to these amazing practitioners. Many of them will say there's no point really looking at your nutrition unless you've looked at how you digest stress. There's no point thinking about sleep hygiene unless you've looked at how you're digesting stress. And even, the medical practitioners we work with would argue that HRT doesn't work as well if you're not looking at how you digest stress. So it's so important. And we know from the data that we get from our community that it is one of the most persistent symptoms right across your menopause journey, as you highlight. And for me, it was the thing that really toppled me over, led to me getting incredibly unwell. I was a sort of type A personality, researcher by trade, working in the creative industries. And over about the period of 6 months, I went from being, relatively comfortable in my own skin. I'd been doing the job for a long time, and I kind of thought I knew what I was doing, to being absolutely crippled by anxiety and not being able to go into a meeting room and feeling confident that I could articulate myself, waking up in the middle of the night worrying about presentations I used to do without even thinking. And all of that sort of led to me just working even harder, like driving myself even closer to burnout, because I felt like the only way I could cope with my brain not behaving like it should and my body not behaving like it should was just to work harder, be more prepared, be more ready, work harder. And obviously what that then did was exacerbate this perimenopause journey, which I didn't know that's what I was in. And I think the other really interesting thing, obviously, about stress, as you say, is it has very physical implications for our long-term health. And so my hair started falling out, I became bloated, I had terrible IBS, I couldn't sleep, I had the most glorious outbreak of acne, all of which obviously meant my confidence levels plummeted even further because I couldn't fit in things, nothing tasted right, So that piece around anxiety, and I think sometimes it feels almost dismissive to say, just do a little meditation. And I was very cynical about any of these lifestyle interventions. So I thought, well, that's just not I'm feeling so awful, none of that's going to work for me. And yet actually, I think, again, what I've learned in my own perimenopause journey is it's the layering up. It's almost like just submit to the fact that some of these practices have been around for hundreds of years. Why have they survived? Why are all the people that I know who do seem to be navigating life well advocates of it? And actually, in the instances of yoga, meditation, breath work, emotional freedom technique, all of these things, there's actually a very good body of scientific research and study now that points to its efficacy in lowering our cortisol levels and managing our stress. So I really do encourage people to sort of not to be as dismissive as I was, because I probably would have got better a lot quicker had I just tried these things out and given them a go,
Yeah. And it is really interesting because you started off being quite cynical. And I know we have people listening to the podcast who've never felt drawn to, say, herbal medication or interventions like yoga or mindfulness. And I think it's all about sort of allowing this time of our life, allowing ourselves, like you said earlier, to be curious, because I know your path led you to really trying to understand more about naturopathy. Like, what the heck is even naturopathy? Most people don't even know what that is, right?
I'll defer to the expert on this one. Yeah, but and what an amazing discipline as well. I think the wonderful thing about all of the experts, I'm sure you get to talk to, Danny, and the ones I get to as well, is the ones I get most excited by are the ones that have that curiosity and that open mind, so that, you know, they know what they know now, but they're also excited about what's coming down the line. And Vera will explain what naturopathy is, but I think from my perspective as a sort of as someone who's just been on the receiving end of it in terms of getting better, what I love is its deep respect for science and medicine.
I love
And
that. I
it's
love
innate,
that so much.
you know, and it's innate curiosity. And then so it's like, okay, absolutely, let's work with the Western medicine protocols and all of the things that science tells us, but let's also look to the evidence and the growing body of research into these other areas. And isn't it amazing when you can blend the two? Like surely, I think actually our generation, we're particularly aware of the impact of that body-mind connection, whereas maybe the generation before didn't necessarily understand the impact of our mindset and our stress levels on our long-term health. So now it's never been, in my view, Vera, correct me if I'm wrong, it's never been almost like a better time to be curious about naturopathy. But maybe, Vera, you can explain what it is.
Yeah, please, Vera, do, because I wonder whether a lot of people at home don't know. You know, to me, it sounds like what we're talking about is what I always bang on about, and that is managing menopause after cancer really needs a multifaceted approach, because we can't lift weight and stop all of our symptoms. We can't have the best diet and get rid of all of our symptoms. It won't work. Even women who are on HRT still have loads of symptoms. There is no sort of one thing that is going to do and really make that huge change. And naturopathy, like you say, it's really, really respecting the science, but layering on top of that different modalities. Vera, explain to us what it means.
Yes, you are doing a really good description, both of you. And actually, I want to say, and I say this often, you know, anyone that has this respect and this view of health and nature, and, you know, how our connection with ourselves and nature can support our bodies, and anyone can actually be a naturopath at heart, because it's exactly that. So, and you know, you may actually you may have a training as a naturopath, but actually you may have a doctor that doesn't have that training, but it does come, you know, with a naturopathic approach that has that naturopathy principles at heart. And so, yeah, that's what naturopathy is about. Although it sounds maybe something a little bit different, but it's actually really down to earth, really like, it's common sense. I find it. It just, at the same time that it brings it all together, you know, it's also very broad in its view. So it has this really sort of broad 360 degrees approach to health. And that's what I really love about it. And so at the same time that it has that approach, it actually really focus on the individual, on that person in front of you, you know, trying to tailor a treatment to that person. So, for instance, as a naturopath, I'm really interested to know who you are, you as a person, beyond your symptoms, you know, what moves you, what are your emotions that are also part of this, of what you're telling me. So that's really important, because that's the information that really helps us to treat, to support that person as a whole. And so think of a naturopath as your, let's say, health partner that is going to help you to figure out what are, you know, the tools that the practices, the self-care tools that work best for you, you know, for you, which may be completely different than the ones that work for your friend. And as Rebekah already mentioned, with naturopathy, we are able to work with several different types of tools, you know, from nutrition to herbal medicine, and like self-care tools like lifestyle changes that are really important to help, you know, with stress management. That's definitely one of the foundations. So you already touched on a few of them. And so we can work with all these sort of these are all part, you know, there's a menu with all these options, and they are evidence-based, and you can use them alongside, you know, conventional medicine in a safe way. So yeah, I think it's just really beautiful, and it just makes a lot of sense.
I love that so much, Vera. And I'm just thinking at home, we are all so much more than our cancer diagnosis. We're all so much more than what happened to us. We're so much more than our symptoms. We're so much more than the roles we play in society, whether we're mothers or daughters or sisters or friends or whoever, whatever role we fulfill, there is so much more to us. And I can't help but think, no one's ever really asked me, who are you? Who are you more than your cancer in all of my 11 years navigating life since a cancer diagnosis? And it's really what's always been missing. Because when we truly answer, what are our interests, what are our needs, our desires, we will all find modalities that resonate with us. I know acupuncture won't be for everyone. Fair enough. If it's not for you, there is no point in trying to bring you to acupuncture if you don't really believe or have a connection to it, right? The same with, putting on makeup. Some people love putting on makeup, others won't. And so we're all so different. Other different things get us out of bed and make us excited about life and the world. And it's so important to encompass that, because healing is so multifaceted. It's a beautiful way of describing healing, what you've just said, isn't it, really?
Yeah, it's exactly that, Dani. Yeah.
Vera, on my poll from speaking to all these women, I know we've got a few more questions about soy and red clover, because when I spoke to Rebekah in the past, we talked a lot about the benefits of soy and red clover. Tell us a bit more why that is so helpful for someone navigating perimenopause, menopause, and why someone might not be able to tap into a whole food supplement, including soy or red clover. I love that you are here. It means so much to me and my whole team behind this show. We released this show for free to help people like you learn more about this often misunderstood topic. And because so many of us feel totally under-supported going through all of this. In return, all I ask is that you help me on my mission by hitting the subscribe button and clicking the button to turn on notifications. It really helps a lot. Thank you. And now on with the show.
Yeah, actually, it's really important to touch on soy and red clover, as they are, particularly soya, is one of the richest sources of phytoestrogens that we already talked a little bit about. And the phytoestrogen, the class of phytoestrogen that soya and also red clover contain is called isoflavones. So you may hear about all these words, so it can be a little bit confusing. Are they the same? Are they not? So isoflavones is a type of phytoestrogen that is present in soya and red clover. And so from all the research available, actually most of the research has been done on soya, because it is, as I said, a rich source of isoflavones. We have more information, in terms of soya than any other types of foods of supplements, but still the research when it comes to supplements is still not conclusive. What we do now, and we go back to food versus supplements. In most sort of, let's say, trustable sources that you go to, you can see that actually experts are comfortable to say that eating soya in its whole food, form is considered safe. If you had a diagnosis of breast cancer, so after breast cancer, there don't seem to be any contraindications, even if you are on medication. As food, so this is really important distinction to make. And again, it's because, soya, as an example, in its whole food format, is more than just an extract. It's got this complex, it's got fiber, it's got, especially if you're talking about fermented types of soya, like tempeh or miso, these are even superior because they bring their probiotic properties. So what we can see from the research is that it may even have a protective effect. So, but that's where they draw the line. When it comes to supplements, the evidence so far, so the research is not conclusive. So some studies may show protective effect, some studies don't. And again, it's all going back to the power of these studies and whether a lot of studies then they use different types of extracts. It's actually quite difficult, to draw conclusions. Is it, different doses of extracts? So when it comes to the extracts and you say, like, let's say processed forms of soya, which is what you find in the supplements, then the advice is to avoid it. Because as with HRT, still not 100% clear as well, even in regards to, let's say, triple negative types of breast cancer or HER2 positive. So just let's say for breast cancer women, the advice is to avoid soya or red clover, in the form of supplements. Red clover, I just want to mention briefly, the red clover is actually, an interesting one because there is not much research on red clover. And in fact, there is a quite interesting study showing actually that, and they followed women for 3 years who had a reasonable amount, let's say, of red clover as a supplement, and they assessed things, like parameters that could be correlated to a risk of breast cancer, and it was all clear. So they could not draw any conclusions that there was any unsafety, let's say. But that's one study. And again, going back to what I said at the beginning, the thing with red clover is there is not enough research. So equally, the advice is obviously to be conservative and also avoid supplements that contain red clover. But both of them, this type of supplements can be very helpful for women who are trying to manage the menopausal symptoms, and either in the supplement format or food, because of this estrogenic effect that helps, to somehow compensate for the low levels of estrogen that the body, is trying to adapt to. And that's why, going back to herbs like ashwagandha or turmeric, if these herbs, are not a possibility, it's even more important to understand the safety of all the others that can actually really make a difference to the cancer community. Until we have more data, obviously. Yeah,
and I think once you understand what you need to stay away from, if you're, for example, on tamoxifen, and what is safe for you, it's actually not such a minefield, because there are many things that are really supportive that we can do. And if we just focus on what you can't have, like I can't have the turmeric in whole food form, then that's just kind of like a bit of a wasted energy, isn't it? It's like, move on. If anyone is listening to this conversation thinking, yeah, I am on tamoxifen, now I know, for example, I'm not going to include turmeric in a whole food supplement. Ashwagandha is something that I can support myself with. So it's also just picking out, and times change. I always like it when people phone breast cancer now. It's a brilliant hotline. And of course, everyone that has been affected by other cancers now, this is a bit not all inclusive, but the nurses are very well trained. However, they also don't always know the latest evidence of all of those studies and the latest research. And sometimes all you hear is not enough evidence. And so you sort of stay away from it. But when I hear not enough evidence, I always think, well, this is okay, because I'm going to do what I want to do with that information. And that feels empowering to me. And that doesn't mean I have to take all of these supplements, but it kind of feels not enough evidence just means people haven't looked enough. Pharma companies will spend lots of money on doing big trials because they will then at the back of it sell loads of medication to people. We just know the same is never going to happen with supplements. And so it's always going to be a less regulated market, isn't it? And so that works against that market. And it's weird that we have more trust in something that the GP would prescribe than in something that we can almost do for ourselves. We've lost trust a little bit, I feel, lost trust in our own ability to navigate health recovery. And we've sort of given that trust to other people sometimes. That's how it feels to me.
And I think it's also when you have had, severe diagnosis, it's incredibly frightening to feel like you're the person sort of like driving the vehicle because the vehicle didn't behave like you expected it to. And I think that's often the feedback we get within the NAR community where we're talking to people who have a history of cancer is you feel like your body betrayed you, it did something you weren't expecting it to do. And then you become less confident that you know how to manage it going forward. So I completely understand that kind of frustration, but also the nervousness about making decisions. And I think, to your point around the supplement space, I really wish that there was more regulation, because I think it would be so helpful to all of us, actually, as we grow in our appreciation of the quality of the food we consume, the limitations quite often to the food we're buying in the supermarket because of the quality of soil, all of the things we know that mean that when we ingest whole food, sometimes we are deficient in vitamins and minerals, and sometimes there are amazing herbs that have been used traditionally in medicine and cooking that we've lost touch with, and we've lost our understanding of how they work. It would be amazing if there was more regulation. I think maybe it's going to be a bit painful, but I kind of feel like there change will happen, because as we become more preventative about health as a world, we are going to have to kind of have these difficult conversations and rethink the way that we evaluate, particularly herbal medicine. Because I think the thing about herbs is, to Vera's point around an adaptogen, for example, it can do so many things. So it's really hard from a clinical and trial perspective to set parameters that are accurate to allow you to track its impact. Whereas when you're looking at a medicine, quite often you can be really specific about what you're looking for that medicine to do. So you can make a very conclusive argument as to whether that product works or not, or whether that particular ingredient works or not. It's much harder to do that with herbs, because again, back to your point around stress, it's also impacted by how that human is and how their world is at that moment in time that they're taking that supplement. How bioavailable, how's their gut microbiota, all of that stuff impacts all of it as well. So it's incredibly difficult, but I think curiosity and applying, in a weird way, being a skeptic, back to my point about completely dismissing anything that felt vaguely complementary for ages. Being a skeptic is not necessarily a bad thing. Sometimes that means that if you do introduce something new, you just apply a lot of curiosity to it. And, to your point, Danny, around whether acupuncture is right or not, how do you feel after each session? How long are you going to give it? What's a fair amount of time? What criteria are you going to use to evaluate it? And then if it doesn't work, you move on. That permission to listen in, I think, is something that we do need to give ourselves permission to do. But I do understand it's really frightening.
Yeah. And how long have you, so when you speak to the women in your community that take your whole food supplements, how long does it take for people to actually notice a difference?
Yeah, I mean, again, everyone's different. So what we found really useful as a community is that we will do product impact studies with our community, and they're from a research point of view, there's sort of pros and cons to any trial, because the minute you invite someone to take your product and they know they're taking it as part of a trial protocol, and they're almost like more diligent because they know that they're tracking their symptoms and they're going to be giving you that data back. So you kind of get this false positive of people being really diligent and taking the product pretty much every day and doing all the things we don't do in real life. And so in those scenarios, we see an impact usually within about 30 days for our powdered products. And actually with mood food, that was really, really exciting, because we saw an impact much quicker. We saw like an impact within 2 weeks of people taking that capsuled formulation. But then we also track people's symptoms in the real world. So for consumers that buy the product, they can choose to do that. And that's, in some ways, that's probably more realistic, because then you do get, they went away for the weekend, or they had the summer off, or, life happens, they were ill, blah, blah. And so then we usually say, try and give it 2 months, because we anticipate you're not going to have, no one does everything every day, do they? However much you intend to. So in those instances, 2 months, 3 months is a good indicator, I think, when I'm advising people on other supplements, I say, if you can take it every day, really, if you haven't seen anything after 30 days, I would become a bit skeptical, personally. Yeah. If you're not someone who's doing it every day, maybe give it a couple of months. But and I think the final thing I would say, again, is a complete, like, not an expert at all, but as a human who was sort of navigating midlife and also rattling around like a pill box because I was taking everything, be really careful about not just, to Vera's point about looking at the kind of quality of the brands that you buy from and the contraindications, but make sure you're not overdosing by accident. Like you're not taking like a vitamin that's a multivitamin you think is totally fine, but then you suddenly added a really powerful product over here. Like, we often have those conversations, don't we, Vera? When we're doing trials, we will know what else our customer is taking, because we're very careful about that. And I'm always shocked at how much we as midlife women are taking. We're taking a lot, and we often don't realise that we're taking too much. Would you agree, Vera?
Yes, definitely. I think actually it is something that particularly I think for this community is really important. Like something, and also like herbal extracts became really popular. So you may actually be on what you think is just a multivitamin that contains like a multivitamin for, let's say, women like 40 plus is quite likely to have herbal extracts, and some of them containing phytoestrogens. So really do your research. And the other thing is there's quite a few brands that use really high, doses of ingredients, including, just even vitamins and minerals. And I think that may not be okay for, most people anyway, but if again, going back to the cancer community, that can be even more of a problem. And so, for instance, when we think about antioxidants, which some, antioxidants that are present in maybe just a normal multivitamin can be contraindicated as well if you are going through treatment, because they can make the treatment less effective. But if you think about those antioxidants as part of your diet, they're actually beneficial. I mean, antioxidants, sound like a good thing, isn't it? It's all about thinking about, using a little bit of common sense. So going back to what Danny was saying at the beginning, we do our research, but we also have to be very curious, mindful, and use common sense to look at things and try to understand as well how these things then work in our bodies. Then going back to the antioxidants, if you're taking certain supplements that contain high levels of antioxidants, as in example vitamin E, which is a quite typical one, it may be a contradiction. But if it's in reasonable levels, maybe okay. So yeah.
What's so good about this? It's more is not always better. I think maybe I'm from a generation where you thought more is better. I need to run faster, run, further. More is always better. More. And that's not the case. And sometimes it's taking the foot off the pedal and thinking, okay, I'm just going to strip back. Less information, less time on social media, less advice from left, right, and center, and just sort of coming back to myself and thinking, is there one thing I need to do for myself, and what could that be? And that might be nothing for a bit of time. That might just be just getting through and then revamping our action plan again. But I really want this to be an action-based podcast rather than people at home just listening. And I know you've done huge legwork in preparing a document for me that I can share with everyone in our community. And we've put it on your website for now. We're going to get it on menopause and cancer as well. And we have quoted, you have quoted every research paper and study about ashwagandha, turmeric, red clover, soy, phytoestrogens. I'm going to link to this document in the show notes. It's incredible. And I really want people to take this to their doctors, to their oncologists, or to any person that just says to them, don't worry about herbal medication. There might be contraindications. Please, everyone, we need to really educate the people we are working with and that are in our team. And I've also got an amazing blog just on our website, and we put that up yesterday, all about herbal medication from Melinda as well. So we've got 2 really good resources on there. And I really hope people are going to spread them wide and far. Because one thing we can't rely on, that just everything the GP can do for us is it. We have got to think further. We have got to think outside the box. Otherwise, we cannot heal. We cannot recover fully. And we do not support us in the best way possible. I think it's short-sighted to think it's either medication or nothing. It's crazy when it winds me up, and you can hear it in my voice, isn't it? When people sort of dismiss a whole world of help, support, things that can be amazing for us. Just quickly, and then I'm going to let you go. Do all of your products, because I don't know, do all of your products contain turmeric, ashwagandha, and red clover, or is there a product that doesn't contain all of those?
The short answer is no. We have products that do not contain, turmeric, and so just briefly, we've got 2 foundation powders. So it's Peri Boost and Meno Boost, and those contain phytoestrogens. So there's something to take into consideration. Then we have a third product called Mood Food. So it's in the name, what it does. It helps with your mood, but it also helps, with anxiety, with brain fog. It's really good for this kind of more, psychological symptoms. That one contains also turmeric. So it doesn't contain phytoestrogens, but it does contain turmeric. So that one, if you are on cancer medication, you may want to obviously discuss that with your doctor first. We have a fourth product, also in capsules, called Gut Instinct. So that's our most recent one. And Gut Instinct doesn't have any, herbs with known contraindications. So that one, it's being developed to support with digestive systems, improving, digestion, reducing bloating, which are symptoms that are quite significant within our community. So that's what led us to come up with this product, our most recent one. The only thing with Gut Instinct is that it contains one herb that it may potentially reduce absorption of medication. So if you are on medication, we just say take it with 2 hours apart, and then it's perfectly fine. But in terms of the ingredients and contraindications with cancer or cancer medication, there aren't absolutely any with unknown so far, obviously, with Gut Instinct. Yeah. So there are options.
You know what? I'm going to come back to you, Rebekah. Yeah, and I was going to let you go, but I'm not going to let you go now, Rebekah. I'm going to come back to you because
I'm enjoying the chat. It's fine. I'm learning lots.
Yeah. I like the fact that you are so openly cynical about even your own products. Like, that almost blows my mind, because you've just said earlier, well, give it a month or two. And if it really doesn't do anything for you, then just move on. Then clearly this isn't anything that's going to work for you. Well, I like that, because you're not saying all of your products are really going to help everyone have a much better experience. And you've got that cynical thinking there. And when I come back to your, for example, the last product you've just used, Vera, we talked about that before, didn't we, Rebekah? And you said to me, look, it's all about probiotics. Everyone, left, right and center, is banging on about probiotics, kimchi and sauerkraut and all of those lovely foods. But oh my gosh, so many people get so bloated from adding loads of those probiotic foods. And so I know your blends, I'm actually mainly working on the prebiotic properties, isn't it? And so that's really quite interesting for me, because I wonder, I mean, I ladle the sauerkraut in because Tim Spector years ago said, you just have a spoonful of sauerkraut. So I'm like the person there at the back of the kitchen with the sauerkraut thinking, oh, that's what I need to do. But my bloating, hello.
Yeah. And I think it's right across. I think by this age, as women, we're old enough and wise enough to know there are no silver bullets, and that MPowder is not a silver bullet. And we've been really clear about that from the start. And we don't work for everyone. Sometimes the format of our products is just impossible to fit into your day. If you've got a really sweet tooth, I can tell you now you will struggle with our powdered products because they're functional and we don't add artificial sweeteners. And so for some people, they really struggle with the taste. Other people knock it back with water and they're fine. But also, if your routine in the morning is such that you don't have time to ladle something in, and, we talk about putting stuff in jam jars and shaking it, but some people haven't got time for that either. So if you can't introduce consistency, we're not going to work. But also, back to your point, Danny, around stress, if you're really, really stressed and your body is screaming for support, then a powdered whole food led supplement isn't going to be the only thing that's going to get you back to feeling well again. And when I think about my own health journey back, it was all about that digestion and stress, and then it was about nutrition, and then it was about moving, and then it was looking at the supplements, and it was that layering up. And I think the other thing that's really important is we may work for a period of time. Like, we're really honest with people about that as well. And we want to be with you for your whole menopause journey, and we want you to age well. But again, if I think back, and I'm sure you're the same, when I first went into my sort of perimenopause, my body was almost in shock. I couldn't run, for example. I just couldn't run. I hadn't got the energy, and I used to love running. That used to be my sort of release of stress. And I was just depleted from running. It made me miserable and sad and shattered. And I had to move to a completely different form of movement. I had to do a lot of lying down the floor. So that was another thing I was cynical about, was yoga nidra. Lots of research on it. It's really good for us. But I just thought it was lying on the floor. And I got interested and curious about yoga, but now I'm back running. So like I'm now 50, and obviously I'm pretty much near sort of like tipping into postmenopause now, and I found a love for running again, which is amazing. But I think that's the same with everything we're doing as women. It's just like keep listening in. If something stops working for you, you might just need to repack that toolkit and try something else, and that's okay. You know, that's what we should be doing.
And before anyone does anything else, go into our show notes, have a look at the resources we have put together. They are incredible, and share them with everyone who is a cynic out there, and just tell them to read them and do their own research. And let's spread the word on the data we have and also the data we don't have. And this has been such a great conversation for me, because I really want to know what works and what doesn't work. And you've given me the answers, and you haven't been beating around the bush. And we've got all of the data to back all of our conversations up. And so I'm going to link that into the show note. Thank you, ladies. It's been fabulous to talk to you. Cynical Rebekah, you've got a new name.
Yeah.
Before
I'm trying.
Before the conversation, people said to me, "Oh, you're going to talk to the MPowder lady," and I said, "Yes, Rebekah." And now you've got another name, Vera. Thank you so much for your passion, for explaining everything to us, for just coming and giving us your time. I can't thank you enough. Thank you for answering all of our questions.
Oh, thanks for having us, Danny.
Thank you, Danny. It was really empowering to be here sharing all of this with you.
I hope that this conversation has been really helpful. And if you're interested in using turmeric, ashwagandha, red clover, soy as a whole food supplement, that we've given you the answers that you need, because these are not supplements okay and appropriate for everyone, but for the person who it's appropriate for, they can have really great effect. And so be a bit more like Rebekah, I think. Let's be cynical. Let's try these things, open doors and open windows. Give ourselves the chance of something helping for us, and then assess in 30 days, in 2 months' time. If it doesn't do anything for us, we're going to move on. But it's really important that we know what's safe and what isn't safe for us, and use our resources listed in the show notes so you can share the research with all of the people in your medical team that you have conversations with. Now, my exciting announcement is Menopause and Cancer are going on the road. Last year's feedback we had is that a lot of the in-person events we did in London or around Surrey area down south in England. And so we're going to go onto the road. We're coming into Yorkshire, and we are hosting an event with Maggie's, which are a fantastic cancer charity in Yorkshire, on the 16th of March. Come and join us for a whole day of mixing and mingling. You'll have access to a menopause expert. We will move together. We have a nutritionist coming in, and I want to come and meet you, because it's really important for me to actually hold and hug and be part of this community, and not just get these podcasts out. Community is at the connection and the heart of everything we do, and I'm really excited about that. And because I know there are a lot more people in Yorkshire that we can fit into Maggie's, we are having a party the night before on the 15th of March in a pub. We've hired a space. Come and meet us. Come and mix and mingle with us. You might even want to stay over in a hotel. Let's have a real good party and mix and mingle. And I can't wait to meet many of you there. If you go onto our social media pages or onto our website, you can find all of the information there. But for now, you know what I'm so grateful for? Amazing and brilliant women like Rebekah and Vera, who are doing so much great work in their space, and who are honest enough to say, okay, this is what we know and this is what we don't know. And our products aren't great for everyone, but for the right person, they can really be helpful. And I just love that approach. This is really, really empowering to me. And I wish everyone was as, just open and transparent as Rebekah and Vera. Anyway, I'm going to love you and leave you, and I'll speak to you on the podcast next week.